Hello, Viva. How are you?
I'm good, sir. How are you?
I'm also good. So, welcome to this session today.
Yes,
And
sir.
today's topic, which we have decided in the morning itself. But what do you think about today's topic, first of all?
So it is going to clear many conceptions, misconceptions, I would say, among the students, which will help
Right.
the aspiring physios too, कि चल क्या रहा है field में. And
Right. So, talking about it, yes, definitely we have been hearing this key like there are so many problems. Physiotherapy is not a good field, or so many students are saying this. Even previous lives, we have heard that students were asking how to convince our parents, and so many things are like that. So people are not much confident about physiotherapy field, and there are various reasons behind that. So we are going to discuss about it and why it is happening like that. And one of the reason what I feel is, yes, it is somewhere relevant with the base what we are looking at. Then, and the base of this physiotherapy field is all the students. If the base is good, we can definitely create a better building of our profession and physiotherapy. So that's the main concern, I would say. And I hope that makes sense, right? Yes. So, Eva, what do you think about like the first thing that all the students have to take care of when they want to join physiotherapy field, and which mistake they are doing while joining the physiotherapy field?
so like कभी कभी ऐसा हो जाता है कि हम लेक्चर्स को सीरियसली नहीं लेते. So मतलब ऐसा लगता है कि बंक कर देंगे, बाद में पढ़ लेंगे. So आई थिंक कि जितने लेक्चर्स हो रहे हैं कॉलेज में कंडक्ट हो तो उसमें ही हमें ध्यान दे के वी शुड लिसन प्रॉपर्ली. और कोई अगर डाउट्स हो तो हमें विलिंगली पूछना चाहिए. ऐसे नहीं सोचना चाहिए कि बेसिक डाउट है और समथिंग. वी शुड जस्ट गो एंड आस्क. डजंट मैटर हाउ मच बेसिक इट इज, बिकॉज हमारा क्लियर हो रहा है एट द एंड. सो दैट इज इम्पोर्टेंट.
That is true. And always, I keep on telling my students sometimes that if you don't ask doubts, I feel like I'm not teaching properly, or I'm teaching fantastically. There can be two reasons if you don't have any doubts. Like I'm telling you 110% things, because of that you are not having doubts, or you are just not bothered about it. So, but the yes, the most of the time it is second option, that students are not much bothered that to ask even doubts, or maybe shy, or I don't know what is the problem. But yes, you are right. Doubts, asking doubts, and concentrating on lecture is very much important. Although you always think, "Ki, okay, we will study it at the last time of the examination," but no, it doesn't work like that. It's not that you are studying only for exams, you are studying for your future, being a good physiotherapist. So if you are studying for that, you have to concentrate on lectures and you have to have doubts. If you have doubts, then only you will learn more and more. Yes, that's a very good point. So thanks for adding that. But before that also, Vibha, like if you come before that, while taking admissions, what do you think the mistakes what people are doing?
Sir, about the college, right? So you have
Yeah.
already made a video regarding it. कि क्या
Yes,
देख
I
के हमें
have
कॉलेजेस
made.
लेने चाहिए.
Yes, but still, like, what is your point of view? Like, what will you consider before taking admission? Like, as right now you're in final year, so you know many of
Yes,
the
sir.
things. So you must be
True.
having some point of views that this should be a criteria. Like, if you are following that criteria, you will end up in a good college, basically.
Yes, sir. So I would tell you few of my mistakes which I made. First of all, लाइक एक्सपोजर का हम लोग ने नहीं देखा था कि घाई घाई में ले लिया था कि एडमिशन मिल रहा है तो ले लो ऐसा. तो आई डोंट थिंक
Right.
एवरीवन शुड डू इट. कि पहले पर्सनली जाके कॉलेज में विजिट करके टीचिंग फैकल्टी कितना है, एक्सपोजर कितना है, वी शुड सी दैट एंड टेक इट इनटू कंसिडरेशन बिकॉज दैट इज द फॉरमोस्ट इम्पोर्टेंट.
Right.
कि एक्सपोजर ही नहीं रहेगा, हैंड्स ऑन नहीं पड़ेगा, फिर थियरी आके प्रैक्टिकल में हम अगर मार खा रहे तो वो बहुत प्रॉब्लमेटिक हो जाए.
Yes, that's a valid point. Yes, so all these things we have to look for. And one more thing, one point I want to add on to this is, Viva, that most of the time students take admission in physiotherapy thinking of कि MBBS में admission नहीं मिला, so physio में ले लेते हैं ये सोच के कि डॉक्टर टैग लगाने मिलेगा या something like that. ठीक है, वो एक सोच होना. Okay, I'm not saying it is wrong to have that kind of thoughts, but don't think like just because you didn't get admission in MBBS, you are going to physiotherapy. You should have some interest in physiotherapy field. You should have some knowledge about physiotherapy field. You should know what a physiotherapist is going to do. If you have that much knowledge and still it interests you, then only you take admission. Otherwise, unnecessarily taking admission, after that cursing yourself, your parents, that why I took admission in physiotherapy, I have no interest in this field and something like that. No, we don't want that. If you do that, definitely you will end up thinking that physiotherapy is not a good fit. So before only, better to have knowledge about this. And yes, as you have mentioned, all these points, exposure, clinical practice, everything matters a lot. Faculties, infrastructure of the college, as well as basic facilities. I'm not saying that every college should have like premier buildings and all, but yeah, basic facilities, if it is there, labs are there, you are getting enough equipments to work on, it's a good place. So like this, you all should, all students who are thinking of joining physiotherapy must think, so that you don't curse yourself later on, right?
Right.
Yes. Next point, what I think of is, what is your point of view about notes and books? Which one do you prefer more?
Like textbooks, because जब I will come to know कि okay इसमें exactly क्या है. बट अगर हम कुछ कोई चीज़ पढ़ रहे हैं तो सबसे पहले हमें टेक्स्ट बुक से पढ़ना चाहिए. अगर बाय चांस कोई पॉइंट मिस आउट हो गए नोट्स में तो वी कैन कवर वो देयर. तो पहले तो
Nice.
टेक्स्ट बुक से पढ़ने चाहिए. आई थिंक इट्स माय पॉइंट ऑफ
So now I can definitely say that you are a good student.
व्यू. थैंक यू सो मच.
Because most of the time, what students make a mistake is they will think like, we will take notes from seniors, we will directly read from that, and we will write whatever comes in our mind from the notes. But guys, it doesn't work that way, because if you're not going through the books, you're not just referring the main content, the notes are useless for you, because those are be going to be useful only for the exam purpose. After exam, when somebody asks you on the patient to perform something or some extra things, you will be like blank, like ये तो हमको पढ़ा ही नहीं है, ये तो हमने देखा ही नहीं है. So that kind of situation, if you don't want to end up, it is the best that you refer books first. And after that, my advice is that you prepare your own notes actually, rather than taking somebody's notes. Because frankly speaking, see how things you are understanding and how things I might be understanding are different. So I might understand some points in a different way, and if I am writing in that way, it will make more sense to me rather than I'm just referring somebody else's notes. So that's something that all the students should work on, if you want, if you don't want to end up in a miserable situation. And this mistakes you can really avoid. Doesn't matter you're in first year, second year, third year, final year, or internship, anytime, or MPT also, right? Then yeah, tell.
Many of them are also having such doubts कि नोट्स बनाना कंपलसरी है. लाइक दे थिंक कि नोट्स बनाएंगे तो ही मतलब अच्छे मार्क्स आएंगे. बिना नोट्स के हम नहीं पढ़ सकते. सो
No, no,
व्हाट
no.
इज द.
It's not compulsory to make notes, frankly speaking. But क्या होता है ना, कैसे कि like my psychology ma'am used to say always कि when you are reading something and when you're writing something, there is a lot of difference. When you read, you can remember maybe 50% of it, but instead of that, when you're writing something, you can remember maybe say 60%, 70%. So that is the main reason that most of us have a tendency कि पढ़ने के बाद थोड़ा सा लिखते जाएंगे, जो points हमको important लगेंगे वो. So when you make those notes, you have tendency of remembering it, like higher chances of remembering it. So that is the reason maybe that we are making notes. But if you're someone who can easily grasp by just reading, you have a good photogenic memory, then definitely no need to make notes if you can remember directly from the books. So it's not a compulsion thing, but yeah, it has some pros and cons of it. Yeah. So talking about this, when do you plan to start seeing patients independently, like private cases, home visits? वो भी थोड़ा fancy रहता है ना अभी आजकल.
हाँ सर. आ जाती है. वी शुड नॉट विजिट. इनकम्प्लीट नॉलेज इज मोर डेंजरस दैन कंप्लीट नॉलेज. मतलब कंप्लीट होने पे जितना हम ट्रीट कर सकते हैं.
True. And I'll tell you what, Viva, like I've seen students going for home visits from third year. I have seen few people going from second year also, but that's really next level thing. I cannot even, what do you say, control myself at that time. But yeah, most importantly, why you should not see is, as you mentioned, yes, incomplete knowledge definitely is worst rather than having no knowledge. So that makes situations really worst. Another point over here is like, when you're seeing patients in third year, final year as a student, you yourself are having very less confidence. And because of that, what you will do is you will be ready to do home visits for any kind of charges. Any kind of means I'm telling you, like, let's say normally physiotherapy visit charges, home visit charges will be 600, 800, or 1,000 rupees. People are there who are students, and because of that, they will charge only 200 rupees, 100 rupees for a home visit. I think there is some network issue with you, or are you able to hear me?
Yes.
Okay. So that's the main concern for me. And after that, what happens? Those people, when they become senior and start working professionally, they will only complain that our field, there are people who will work for 200 rupees also, 300 rupees also, and then patients are going with them only. So to avoid all these situations, first you should not be in that situation. We have to make sure that when you're a student, you're not doing it. And let's say that okay, he or she is some of your relative, the patient is your relative, and you want to help them out, then help them with a concern of your seniors or somebody who is already practicing, so that you have a guidance of that person. You are not doing anything wrong with the patient, and so such a way you will maintain the dignity of profession, as well as you will make some sense when you are treating a patient. So that's the main point, main concern I wanted to put out over here, that if you are a student, guys, please don't just do home visits just for sake of doing it. Otherwise, it's not going to work for you. It will be like, it's like a karma cycle. After a few years, you will only face this situation that your juniors are doing for 300 rupees, and you will be struggling for getting a home visit for more charges. Simple as that. Hmm. Okay.
People will see कि हमें कहाँ कम रेट में मिल रहा है, कहाँ जल्दी, rather than
Exactly.
कहाँ ज़्यादा पे मिल रहा है और टाइम जा रहा है.
Or frankly speaking, our patients are also like that. They will not think about the quality. They will think कि नहीं यार, मतलब यही तो करना है ना, फिजियोथेरेपी तो है, एक्सरसाइज वगैरह करना है तुमको तो कोई भी करा लेगा. अरे भाई साहब, ऐसा नहीं होता. अगर वो वही चीज अगर कोई क्वालिफाइड फिजियो जाएगा तो वो एक्सप्लेन कर सकेगा कि what exactly we are doing and what scientific way we are giving you exercise, and it is customized for each and every people. सो वो जब तक प्रॉपर एजुकेशन आप देने के लिए रेडी नहीं हो, प्लीज डोंट डू ऑल दिस थिंग्स. अदरवाइज आप प्रोफेशन को खराब कर रहे हो, और उसी वजह से आपका भी फ्यूचर खराब हो रहा है. सिंपल. Here somebody has commented, Vibha, that this is Harshita actually. Yes, this is the thing which put pressure on us who haven't joined clinic yet by those students. And we feel like we don't know anything even after trying to grasp knowledge as much as we can. Yeah. So you're talking about the situation when students are going for home visit. Yeah, I understand that. That happens sometimes. But as I mentioned, should not do that. If you're doing, please do with proper concern and proper guidance. First of all, don't do it in bold letters. But even in spite of this, also you want to do it of your relatives, do with proper guidance. Yeah. Yes, and just now you were mentioning, Viva, that clinical postings have started for your final year. So how is it going?
Get to learn
Okay, fine,
it's good.
good. चलो, ओवरऑल मतलब अच्छा जा रहा है तो अच्छी बात है. बट स्टूडेंट्स पॉइंट ऑफ व्यू मेरे हिसाब से आपको. यस, व्हाट हैपेंड? Okay, so maybe a little bit of network issue here. Now you can hear me, Viva. Okay. So we'll just wait for a while. And guys, yes, apart from this, what I was saying was कि अगर आपको ऐसा है कि नहीं क्लिनिकल पोस्टिंग्स में आपको पेशेंट्स का एक्सपोजर है वगैरह है तो आप कैसे उसका मैक्सिमम एडवांटेज ले सकते हैं दैट इज व्हाट यू हैव टू लुक फॉर. So definitely yes, teaching stuff will be there. Sometimes you might be feeling okay, what kind of cases are coming, or sometimes it will be like same type of cases are coming. Let's say for example in neuro, you will be seeing only cases of stroke. Or sometimes it will happen that if you are posted in pediatric posting, you are seeing only CP patients. But you must be seeing that each and every patients have different symptoms, different clinical features. So just try to concentrate on those. Just try to explore those things. Like a stroke is there, okay, fine. Which artery is involved? MCA is involved. ACA is involved. Then you just try to figure out. Like really in MCA, most of the time we have heard that there will be Broca's aphasia. So are we seeing in all the patients with MCA artery involvement Broca's aphasia, or only few of the patients we are seeing it? Same way in CP patient also it may be spastic, it may be diplegic, it may be flaccid. So what kind of cases are coming and what is their history? If you can relate with that and you take maximum advantage of it, it will be very good for you because this is like investment. When you are investing in all these things, when you are going in future somewhere to work, you will have this already habit of taking all the details of patient and you already know what to do in which type of patients, so you can take advantage of these postings that way. Some of the students again are not getting postings itself, they are like posted somewhere but no patients are there. So for them I really feel bad, but again without don't feel bad and just start working on yourself. As I mentioned here, those who are seeing all these things, those who are not seeing patient, they can also do all these things by just researching. Like okay fine, today is Monday, you will just focus on all the cases related to orthopedic conditions. आप बस जाके कोई भी रैंडम सा कंडीशन ले लो और वो कंडीशन पे एक या दो चीजें गूगल पे या गूगल स्कॉलर पे आर्टिकल पढ़ लो कि ये कंडीशन के पेशेंट को क्या ट्रीटमेंट दी जाती है, या यू जस्ट गो थ्रू अ मेटा एनालिसिस और सिस्टमेटिक रिव्यू समथिंग लाइक दैट. तो आपको सिर्फ पढ़ के एक आइडिया आएगा कि ओके दिस काइंड ऑफ पेशेंट्स आर कमिंग, देन दिस काइंड ऑफ ट्रीटमेंट इज गिवन to the patient. And once in a while, whenever you're getting a chance of seeing patient, you can apply those things, apply that knowledge over those patients. So that is what I think you can do, because you cannot change your college just for the posting because you're already in third or final year. So don't just think about all these things, rather than try to find a solution what else you can do, or if possible just go for observation shifts somewhere, if time permits to you all, just to observe patients if somebody is allowing you, that also is a good option by the way. Yeah, but I am happy that you guys are going for good postings and taking advantage of it. And don't forget to take advantage this way also, which I just mentioned. Okay, all right. Then what do you think about the soft skills? Because I have a very good something to say about soft skills which we all lack. Like even when I was student, I was not concentrating on soft skills, how to like communicate, what are the things I should know apart from treating patients, right? So right now, let's say if you are also treating patient, then you are already guided that okay, your staff is telling you that this is a patient of this condition, you have to treat that patient. You will just directly go to the patient and you will maybe if file is there, you will just go through the file and then you will start treating them according to the guidance what is given to you. Now in this we need to learn about like how to communicate with patient without making an awkward situation. Sometimes it
Right.
happens, right? Ki patient comes to us, we are going to the patient and we have to ask some questions to the patient like how it started, or what happened to you, what is the mechanism of injury, that is what you want to know, or any history is there in family, something like that you want to know. So you cannot directly just go and ask patient कि okay हाँ पहले कुछ ऐसा हुआ था आपके घर में किसी को ऐसा कुछ है क्या. When you ask directly something like that, that patient might not be comfortable or you make an awkward situation over there. So you need to start learning those soft skills, like how to approach to the patient, how exactly you introduce yourself, like how in exams you guys are doing. That in exam, when you go to a model, you will explain, okay, I'm third year student, I'm final year student, I'll be performing this things, and if you have any discomfort, you let me know, right? That is what you are learning in practical exams. So same way, when you're seeing patient also, there are certain things which you can start by introducing yourself, as well as you can just communicate, okay, what is your name, or you can just start with like, okay, now how is your treatment going on, how are you feeling today, for example. Okay, so all those things, small things, but really matters for patient. Patient will feel that yes, this therapist really cares for me. That is why he's asking me these questions. So here I'm not.
Yeah.
Yeah, yeah. Yes, we battle.
Yes, like पहले patient को comfortable करना, that is also important, and we should try to understand the psychology of the patient, कि what is
Yes.
going on inside his head, so that we
Yes.
could help in some or the other way to make him feel relaxed, comfortable, and make the treatment protocol more in a more proper way.
Yes. और कभी कभी जैसे just now you mentioned some patients will come who will tell that no, I just want machine. Like कभी कभी कोई patient का ऐसे
Yeah.
होता है कि मुझे बस वो शॉक दे दो यहाँ पे, मुझे अच्छा हो जाएगा. सो उस सिचुएशंस में आप ऐसे इरिटेट नहीं हो सकते कि नहीं यार, ये पेशेंट को तो बस मशीन चाहिए और जाता है वगैरह वगैरह, ऐसा हो जाता है. ठीक है, पर व्हाट वी कैन डू इन स्पाइट ऑफ दिस इज वी कैन एक्सप्लेन दैट, that see, this machine is working like this, so it is going to help you in certain ways. So if you really want to get improved, you have to do this also, you have to do this exercise also, and that is the way you can improve yourself. So only these things, if you can easily communicate with your patient, that is going to change yours as well as patient's life. So that is where this soft skills comes. And soft skill again, about apart from communication skills, you also have to develop your financial skills. क्योंकि आगे जाके see, money matters for everyone. We are doing this, we are studying this, everything. Why are we doing this? Because we want to earn good amount of money. And that is where every physiotherapist is complaining also right now, that in physiotherapy field we are not earning money and all. But for that, have you done some hard work to understand how the financial matter works? Do you have some skills, like for example marketing skills, or other skills, financial skills, which are required to run a clinic or to work somewhere? So you just can just start learning those things from final year or internship, that okay, this is how the financial matter works, this is how the patient psychology works, this is how we can grab more and more number of patients. Okay, and this is how we can charge to the patient, this is how we can manage all the financial things which is coming to the clinic, so expenses and everything. So those things are also very important, which we have to learn. Nobody is going to teach you that, no college will take classes for that, but this you have to learn by yourself. And if you learn that by yourself, then only you will improvise. That is what I would like to say on this topic.
That is
Yes.
very important, sir. Yes, sir.
And see, and especially in Indian culture, we have a habit कि हमारे पेरेंट्स ही हमारा सब कुछ देख लेते हैं कि हाँ बेटा, तुम्हारा खर्चा ये है, ये वगैरह वगैरह. पर हमको अभी इंडिपेंडेंट बनना है, तो हमारा खुद का इन्वेस्टमेंट भी हमें करना है, हमारा खुद का सेविंग्स भी हमें करना है, हमारे खुद के एक्सपेंसेस भी हमें करना है. तो वो चीजें सीखेंगे तो ही होगा. सिंपल. Now May is asking, does certified manual therapy course is beneficial? Go ahead.
सर अबाउट दिस यू हैव टॉक्ड इन योर लास्ट सेशन, कि ऐसे बहुत सारे कोर्सेज होते हैं जो 2-2 दिन में खत्म करके दे गिव सर्टिफिकेट एंड कि तुम कुछ भी कर सकते हो ऑन पेशेंट, बट आई डोंट थिंक इट इज बेनिफिशियल एंड इट माइट टर्न hazardous to patients as well and to the therapist's future also, because अगर
Yes.
कुछ थोड़ा भी गलती हो गया तो पेशेंट विल कंप्लेन ऑब्वियसली कि इसने क्या कर दिया, they will not
वैसे
think.
हाँ, वो बात सही है आपकी विभा. और एक प्रॉब्लम और क्या है पता है, कि लाइक हमारे पेशेंट उतने स्मार्ट नहीं है. दैट इज व्हाई देयर आर सो मेनी दिस कोर्सेज एंड एवरीथिंग इज कमिंग अप, कि nobody is going to complain, and we are not scared of it. If it was some other country, definitely we will be scared of performing something on patients, because patient can directly go and complain on you, right? So answer to this, manual therapy courses, if you want to do the some established courses. Like for example, you can do the Mulligan workshop, and that too is done by Mulligan practitioners, Mulligan certified educators to be specific. And there are only two in India who are certified educators just by Mulligan, who have studied under Mulligan, and after that they have got that degree to educate other students about Mulligan technique. From those people, if you are learning, yes, definitely it is going to be helpful. But if you're just randomly learning from some people without checking the background, I'm not sure whether it will really help you or it will not. Yes. Okay. So that's the way it works. Uh, so that also, I think we had discussed about this point also, that invasive therapies people are crazy about right now. That mistake also students are making. Like for example, to be specific, dry needling and cupping
Cupping.
therapy, right? Pajama therapy. I have been involved in so many what do you say, comment fights with people about this. Ki, no, it is really helpful and it is not and all. But ultimately, everything ends up over the whatever evidence is available. So, guys, all the students, this is a again one major point you have to take in consideration, that physiotherapy curriculum itself is sufficient for treating any kind of patients if you are really focusing in that and you are upgrading your skills. Apart from that, if you want to learn something new extra, then you can definitely learn, but it has to be something relevant to physiotherapy. Like for example, if you're concentrating on muscle energy technique, METs, or you're concentrating on let's say sometimes taping techniques, or your MFR, myofascial release techniques, okay, or PNF, which is a core part of our physiotherapy profession. So like these techniques, if you're working on it, McKenzie, Mulligan, then it is good. Okay, fine. But if you're going beyond that and going somewhere in invasive therapy, which is actually should not be part of physiotherapy, then you'll be on a shaky part, like, okay, whether you are a physio or you are a needleist or what you are. So it's a, again, reality check for all of you, right? Rather than just falling for just this fancy looking treatments, just don't ruin our profession. That's what I can say.
So many of them are also confused कि dry needling, cupping ये physiotherapy का ही part है और it is it different?
Mhm.
So yeah,
No, no, it's not obviously, right, because
yeah,
फिजियोथेरेपी का
it's not.
डेफिनेशन हमको पता है कि फिजियोथेरेपी इज कम्प्लीटली नॉन इन्वेजिव थेरेपी, जिसमें हम कुछ इन्वेज करने की कोशिश नहीं करते हैं, क्योंकि हमारे पास इतने सारे टेक्निक्स है कि उसकी हमें जरूरत भी नहीं है अभी फिलहाल. And you won't believe, Vipa, like recently I came through one content which is saying that the old generation physios are not accepting these new techniques because they are not flexible enough. But it's not that way. We are just following simply evidence. Like, what is the evidence say? There are so many lots of research is already available, and I'm not saying that about dry needling it is not available. But when you compare those dry needling research with MFR techniques or stretching techniques or MET techniques, there has been always proven that MET is better or MFR is better or something is better. So that is the main thing. So, and that kind of thing is not told to the students. Most of the students are brainwashed, and that too is done in colleges only. That's the harsh reality, that colleges are sometimes brainwashing the students about these techniques, or sometimes seniors are doing it. So should not be done, should be stopped as early as possible. Yes. There is a comment, Gorford Jayashri. Sir, I am student of BPT studying in SSGH Vadodara MS University. On one of the hospital that most patients come for physiotherapy. So for the posting related problem is not here. It's my luck. That's good for you. It's really good
Yeah.
that you are getting good number of patients. So just take maximum advantage of it and become a good physiotherapist. That's all I can wish for you. Yes. What are best medical diploma for physio after BPT according to you? Best medical diploma for physio after BPT. Why would you do diploma course after bachelor's degree? That is my first question. And yes, I know that diploma courses are being done, especially if you go to Canada. कनाडा में जो भी मास्टर्स करने जाता है वो एक्चुअली मास्टर्स करने नहीं जाता, डिप्लोमा कोर्सेज करने जाता है. वो शायद आधे लोगों को पता भी नहीं है. अगर आप देखोगे तो दोज ऑल आर डिप्लोमा कोर्सेज, 1 ईयर 1.5 ईयर. तो वहाँ पे ऐसा है कि आप एक्सरसाइज साइंस में डिप्लोमा कोर्स कर लिए, आप काइनेसियोलॉजी में डिप्लोमा कोर्सेज कर लिए, बट इंडिया में एज स्पेसिफिक टू दैट देयर आर नो डिप्लोमा कोर्सेज अवेलेबल आफ्टर टू डू आफ्टर बीपीटी. हाँ, there are fellowship programs that you can do after BPT or MPT, which are being done in so many private universities like DY Patil is there. Then There are some of the fellowship programs done in
Manipal.
Manipal also, yes. So from there you can do some fellowship programs which are of like 2 months, 3 months, 6 months, depending on the course, in which they will be giving you like real life experience of those particular. Like fellowship means what? Specialty wise. Like in neuro also they will give you only stroke patients. They will give you only CP patient. So like that fellowships are there which you can take advantage of. But don't fall for any diploma course if you are planning to do in India. That's the
Right.
concern. Yes. Then talking about this, yeah, the most what do you say, like interesting thing according to me is what is your point of view about conferences which are happening in and around like physiotherapy profession?
Okay, so
How many conferences have you attended so far?
I had attended one conference last year, which was conducted in Pravra. It is a
Okay.
deemed university
Yeah, I know
near
about it.
Loni.
Good. All right. And what did you do in conference?
Okay, sir, I'll give my honest answer.
Uh,
कुछ टाइम तक आई वॉज कंसिस्टेंट कि ओके मेरे को समझ रहा है बट एट आफ्टर सम पॉइंट आई वॉज लिटरली बोर्ड लाइक मतलब ऐसे ठीक है बोर हो रहा है चलो जाने दो
right.
ऐसा हो ऑनेस्टली बट या अगर कोई पूरा डेडिकेशन के साथ बैठ सकता है तो गो अहेड
डेडिकेशन के साथ बैठना एक्चुअली उतना ही मुश्किल है जितना पूरा मतलब 9 to 4 क्लासेस में पूरा डेडिकेशन के साथ concentrate करना. And I really know that and I understand that. Now, why I am asking this is because we know that in physiotherapy profession, lots of conferences are happening. Now, most of the conferences, उनका intention कुछ और होता है. और especially now as we are talking about students, what mistakes students are doing, most of the students का भी intention कुछ और होता है. What students think that is conference means we will just go for cultural program, DJ night, then like food and discovering that place. For example, if the conference is in Manali or let's say conference is in Delhi, conferences in Amritsar, some places like that, or conferences in Bangalore. We will just go there, we will roam around the place, we will enjoy. It will be like a class trip and we will come back. So that is the way you are missing a lots of opportunities which you could create by being there in the conference.
नेटवर्किंग
Yeah, networking. Like I'm saying that, see, I'm not saying that I have not done this mistake. Even when I was student, I have made these mistakes, and that is how I have learned it, and that is why I want that the future generation don't make this mistake. So what happens? Ki when you are being there in conference, at least you meet different college students over here. You will come to know that whether how better your college is in compared to their college, or how bad your college is in compared to their college. That is the first thing obviously students are going to talk about. Okay, then you will talk about also like, okay, what all things you are learning new in physiotherapy, what is motivating you to become a good physiotherapist. Those things can be exchanged. And ultimately, as you mentioned, networking. So what happens after you are clearing your internship and you are looking for certain roles in other states, other parts of the India or somewhere else? You always have a network over there. Like because you went to conference in Amritsar, you know some physios in Amritsar. Like for example, we discussed that you want to get admission in GNDU. So GNDU is in Amritsar. You already went to conference. You have some contacts in Amritsar now. So whenever you want to go over there, you already have the all the knowledge what you want from them easily. That's a small example. Apart from this, let's say you are doing MPT, you want to share your like you're doing some thesis, you require more and more population for that. You can seek help from all those physios with whom you got connected. कि हाँ ओके ये फिजियो से मैं थोड़ा डेटा ले सकता हूँ या ले सकती हूँ और अदर फिजियो से मैं डेटा ले सकता हूँ ले सकती हूँ. तो
हाँ जी
ऐसे करके क्या होगा हमारा एक नेटवर्क बिल्ड हो जाएगा. सिर्फ हम ऐसे नहीं कि हम सिर्फ हमारे फ्रेंड्स को जानते हैं पर उसके अलावा भी हमारे बाहर भी लोग फ्रेंड्स हैं जो हमें हेल्प कर सकते हैं या हम उनको हेल्प हेल्प कर सकते हैं. इट वर्क्स बोथ द वे. So that is the best part of conference. Plus the faculties or resource person who are coming from outside in conferences. Some of them are really good. जो कभी कभी आपको उनका नाम सुना होगा आपने पर आपको वो मिलने नहीं मिलेंगे कभी कभी या तो फिर यू विल नॉट बी एबल टू इंटरेक्ट विद देम लाइव. लाइक फॉर एग्जांपल हियर वी हैव एन एडवांटेज कि हम यहाँ पर डिस्कस कर रहे हैं. वहाँ पे आपको शायद ना मिले। तो वो कॉन्फ्रेंस एक जगह है जहाँ पे आप जाके सिर्फ़ एक सिंपल से अपने डाउट्स क्लियर कर सकते हो या कनेक्शन बना सकते हो। कि हाँ ठीक है, लाइक इफ आई वांट टू डू दिस अपार्ट फ्रॉम फिजियोथेरेपी, लाइक फॉर एग्जांपल देयर आर few people who want to do something in hospital administration, public health, who want to do something in management side. So how to do that? वो सारा मतलब आप किसी सीनियर से ही ऑब्वियसली ज़्यादा अच्छे से आपको जानने मिलेगा इन कंपेयर टू योर बैचमेट्स। तो वो सारी चीज़ें आप कॉन्फ्रेंसेस में कर सकते हो। और मज़े तो करने ही हैं, ऐसा नहीं कि बिल्कुल नहीं करने, डीजे के टाइम पे डीजे भी करना ही है, बट थोड़े बहुत लेक्चर्स जो कुछ आपको यूनिक लगे, पहले से ही देख के रखो, वो एटलीस्ट वो लेक्चर्स को अटेंड करेंगे तो आप एडवांटेज ले सकते हो। बिकॉज़ मोस्ट ऑफ द पीपल राइट नाउ व्हाट दे आर डूइंग इज़ व्हाट मिस्टेक दे आर डूइंग इज़ कि आप सिर्फ़ सर्टिफिकेट के लिए कॉन्फ्रेंस अटेंड कर रहे हो और उस सर्टिफिकेट मिलने के बाद उसके साथ फ़ोटो खींच के सोशल मीडिया पे पुट रखने के लिए, कि भैया हमने ये कॉन्फ्रेंस अटेंड की है। पर अल्टीमेटली अगर पूछो कि इसमें क्या सीखे हो, तो पता नहीं,
So what
राइट?
will be the benefit of the certificates like in future?
बुरा लगेगा मैं ये बोलूँगा तो, पर कोई बेनिफिट नहीं है।
Oh my god. Okay.
अ, देखो, मैंने ये मेरे पिछले क कुछ लाइव में सेशन में भी बोला है, कि ये सर्टिफ़िकेट्स ना मेरे पास जब मैंने भी अपने बीपीटी टाइम पे मैं फर्स्ट ईयर से पोस्टर प्रेज़ेंटेशन करता था मैं। मुझे उतना इंटरेस्ट था उसमें। पोस्टर प्रेज़ेंटेशन आई यूज्ड टू डू, देन ऑल द ईयर आई हैव अटेंडेड एट लीस्ट 2 कॉन्फ्रेंसेस। तो मेरे पास इतना मतलब बहुत सर्टिफ़िकेट, स्पोर्ट्स में था मैं, कल्चरल में था, वगैरह-वगैरह करके काफ़ी सर्टिफ़िकेट जमा किए थे मैंने। बीपीटी के बाद मैं जॉब के लिए बड़े ऐसे कॉन्फिडेंट के साथ पूरा फाइल लेके गया कि बॉस अपने पास तो इतने सर्टिफ़िकेट्स हैं, अपन मतलब देख लेंगे। You won't believe, people wants to know what skills do you have? What do you know if in given situation? If I give you a case right now, how confident you are to treat that patient? अगर आप में वो कॉन्फिडेंस है, आप में वो स्किल्स है, वो सर्टिफिकेट्स का कोई काम नहीं है बॉस। कोई मतलब कोई भी काम नहीं। फिर हाँ, दिखाने के लिए आप दिखा सकते हो कि मैंने ये चीज़ें की है वगैरह-वगैरह, पर वो सर्टिफिकेट है, पर उसमें से आपने क्या सीखा है, तो वो तो फिर आपको ही बताना पड़ेगा। वो तो आप कॉन्फ्रेंस पीछे जाके उसका वीडियो तो दिखा नहीं सकते ना, ये देखो मैंने ये सीखा है करके।
Hmm.
सो अल्टीमेटली व्हाट मैटर्स इज़ what skills
Skills.
you have and how much
Hmm.
presentable you are over there when you are giving interview. So सर्टिफिकेट का वैल्यू नहीं है, उससे आप क्या सीखे हो उसका वैल्यू है, हमेशा याद रखना, फॉर एवरीवन। ओके, यस। व्हाट मे बी द अप्रॉक्सीमेट टाइम फॉर हेमरेजिक स्ट्रोक? अरे ये क्या सवाल हुआ? अप्रॉक्सीमेट टाइम फॉर हेमरेजिक स्ट्रोक, आर यू आस्किंग इन टर्म्स ऑफ कि ये होने के लिए कितना टाइम लगता है, कि होने के बाद कितने टाइम में रिकवरी आ सकता है? इफ यू कैन जस्ट क्लियर, या ओके, यू हैव मेंशन रिकवरी। ओके, so recovery for hemorrhagic stroke is actually little bit delayed in compared to ischemic stroke for several reasons। कि hemorrhagic stroke में definitely जो blood supply था वो काफ़ी हद तक मतलब खराब हो चुका था, उस वजह से patient was in that situation। So to get back that blood supply, to get the revive those parts of brain is a very difficult task। तो ऐसा कह सकते हैं कि recovery takes a longer period of time in compared to ischemic stroke in this। Sir, Quacks are coming up here in Nizamabad. There is person study up to 12th. Did vocational course. Yeah. So all these things, why it is happening? Bro, don't think about why IAP is not working. You think about what you are doing. See, as I mentioned earlier, also students are doing home visit. That is also Quacks only. So we have to stop it from our side first. Then we can complain about the other people. Remember this. What's the point in doing the course? We have 4.5 years. What's the point in doing the course? We have 4.5 years. You are talking about some other courses or you're talking about physiotherapy? If you can be more clear, I can answer that question. So I'm
I think
done
he is
BPT.
asking कि जो क्वैक्स होते हैं वो 1 और 1.5 ईयर कुछ ना कुछ ऊपर-ऊपर से पढ़ लेते हैं एंड दे स्टार्ट गिविंग ट्रीटमेंट।
अच्छा,
बट
ओके ओके ओके।
फिजियोथेरेपिस्ट दे स्टडी फॉर 4.5 years इतना पढ़ के आई थिंक ही इज आस्किंग
या यू
दैट।
अंडरस्टूड राइट एक्चुअली, या इन बिटवीन वो एक मैसेज था इसलिए शायद नहीं समझ में आया, बट या। सो राज, एज आई मेंशन, हमें हमारी साइड से क्लियर रहना है। वी हैव टू लर्न, वी हैव टू स्केल अप इन सच अ वे कि योर स्किल्स आर शोन अप, कि एज़ अ फिजियो यू हैव द स्किल्स, एंड वो 12th पास का स्किल जो है वो सिखाया रहेगा, वो देख के जो सिखाया,
हुँ,
उसको डेफिनिटली स्टॉप करना है हमें उधर ही। ऐसा नहीं कि वी हैव टू लेट लेट हिम वर्क, But you have to show up first. You have to raise awareness about what is physiotherapy, how much they study. जब आप अपने फैमिली को, अपने नेबर्स को तक को अवेयरनेस नहीं फैला रहे हो अभी राइट नाउ इन करंट सिचुएशन, it happens like your neighbor doesn't know what physiotherapy is, and you are trying to tell that you are trying to stop those 12th pass people. How is it possible? First you educate our people that this is how physiotherapy works and this much degree is required to become a physiotherapist. If they know, they will never hire a person who is just 12th pass. Simple as that. Yes, so sir, I am done BPT from Akupatna, but here is the not given proper class. Then, sir, you can advise any platform that is given proper classes. Okay, क्लासेस के लिए एक्चुअली नॉर्मली कॉलेज आपने इसीलिए ज्वाइन किया था कि आप क्लासेस अटेंड कर सके, फर्स्ट थिंग। और आपको फिर भी कुछ सीखना है तो देर आर डिफरेंट प्लेसेस, बट आई वुड नॉट डायरेक्टली रेफर टू यू फॉर दोज थिंग्स। आई वुड से दैट फर्स्ट यू रेफर द बुक्स, ट्राई टू क्लियर योर कंसेप्ट एज मच एज पॉसिबल। उसके बाद आप हेल्प ले सकते हैं, जैसे यूट्यूब में काफ़ी अच्छे अच्छे एजुकेटर्स हैं जिनसे आप कुछ सीख सकते हो, या तो फिर आप जैसे फॉर एग्जांपल मेरा खुद का एक एप्लीकेशन है जिसमें ऑनलाइन एजुकेशन मतलब क्लासेस वगैरह होते हैं, तो उसमें से आप कुछ ना कुछ सीख सकते हैं। बट दैट इज ऑल कम्स वंस यू ऑलरेडी हैव सम बेसिक नॉलेज अबाउट इट। आप क्लासेस को डायरेक्टली ऐसे रिप्लेस नहीं कर सकते यूट्यूब वीडियो से, ये वो मैं भी मानता हूँ। पर आपके पास कोई भी ऑप्शन नहीं है तो फिर आप ऐसे हेल्प ले सकते हो। Like Viva is also guiding so many students that way, and even my channel is there where we are guiding students and we are putting some educational content for you all, so you can just take advantage of that, but don't just rely on that only. CGPA matters, and what's your CGPA in bachelor's? Frankly मेरे टाइम पे ये CGPA वाला झंझट नहीं था ज़्यादा, so मेरा मुझे पता भी नहीं मेरा क्या था क्या नहीं था। But yes, it matters if you want to enroll in foreign universities. They look for certain basic like minimum CGPA score, so you can focus on that. I want to prepare for MPT entrance exam, but I can't understand how to start and where is go for preparing. कोई आंसर विवा इसके लिए?
तो so what is your point of view? Because आपको ज़्यादा experience होगा इस मामले में।
MPT entrance, see, if, frankly, if you have done BPT properly, your basic is clear. Just now, as all the points we have covered so far, कि आपने कॉलेज के लेक्चर्स में अच्छे से ध्यान दिया, सिर्फ एग्जाम के लिए पढ़ाई नहीं की है,
हाँ, हाँ,
और
हाँ।
पेशेंट ट्रीट करते टाइम आपने अगर प्रॉपर्ली फोकस किया है, ये सारी चीज़ें अगर कॉन्सेंट्रेट की है, तो एमपीटी एंट्रेंस एग्जाम बहुत ईज़ी है आपके लिए। क्योंकि उसमें क्वेश्चंस जो है वो ये बेसिक्स ही आने वाले हैं कि एनाटॉमी के बारे में या तो फिर एक्सरसाइज थेरेपी के बारे में, पेशेंट सिचुएशन के बारे में। तो ये सारी चीज़ें आप प्रिपेयर करने के लिए आपको फिर और कहीं नहीं जाना है, बस आपको बस एक बार रिवाइज़ करना है अपना पूरा जो करिकुलम है उसको, और आप बहुत अच्छे से उसको क्लियर कर सकते हो। पर ये सारी चीज़ें अगर आप नहीं कर पाए थे, तो आप शुरू कर सकते हो बेसिक मोस्ट थिंग व्हिच इज़ फ्रॉम बायोमेकेनिक्स एनाटॉमी से। उसके बाद आप पढ़ सकते हो फ्रॉम डेविड जे मैगी एंड सुज़ैनो सुलेवान व्हिच इज़ फोकसिंग ऑन योर असेसमेंट पार्ट एज़ वेल एज़ कंडीशन एंड रिहैबिलिटेशन पार्ट। तो ये अगर 3 चीज़ें अगर आपने अच्छे से पढ़ी है, बायोमेकेनिक्स, डेविड मैगी एंड सुज़ैनो सुलेवान, तो आप अच्छे से क्लियर कर सकते हैं कोई भी एग्ज़ाम हो। Theraband expert, Pilates expert, acupuncture expert comes under physiotherapy, and how can we pursue them if we have interest in it? Theraband expert मैंने पहली बार सुना है, पहली बात तो ये। पिलाटिस एक्सपर्ट हाँ मैंने सुना है। एक्यूपंक्चर एक्सपर्ट अगेन इन्वेसिव थेरेपी है तो उसको जाने ही दो। Pilates, it's not like it is coming under physiotherapy, it is something extra skills you can learn. And yes, there are certain official people like IAFT is there, Indian Association of Fitness and Training. Dr. Surjit Chakraborty, I remember. He is like certified person to give classes for Pilates, aerobic exercise, prenatal, postnatal exercises. Who runs courses, I think, entire India. So you can just contact that person for the same thing. Have you heard of this Theraband expert Viva ever?
नो सर, पिलाटेस एक्सपर्ट्स के बारे में सुना है, थेराबैंड फर्स्ट टाइम।
ठीक है, तो ये मेरे लिए भी नया था, तुम्हारे लिए भी नया था। रिसर्च करेंगे इस पे, बाय द वे देखते हैं।
Yes.
क्योंकि थेरापेंट वैसे नॉर्मली हर फिजियो सीख मतलब ऑलरेडी यूज कर ही रहा होता है बीपीटी से,
Hmm.
सो उसके लिए एक्सपर्ट क्या है वो देखना पड़ेगा। यस। अब है, शुड वी गो टू फॉरेन फॉर फर्दर एजुकेशन आफ्टर बीपीटी? इसका जवाब मैंने शायद दिया था लास्ट लाइव में ना।
Yes, sir. Please watch
ओके।
the previous live session, Vaishnavi.
यस सर, आई एम स्टूडेंट ऑफ बीपीटी फर्स्ट ईयर, हाउ शुड आई स्टडी डेली एंड हाउ मैनी आवर्स शुड आई स्टडी? ये तो विभा ही आंसर करेगी।
Okay, so there is no particular time. Like I think you should give like 6 घंटे पढ़ना तो continue 6 घंटे. You can distribute that time 2 hours, 2 hours, 2 hours because you have many other activities attending college or if you have interest in sports then you will play sports. थोड़ा time खुद के लिए. So don't just study continuously for whole day. Distribute your time and you will do it. Just don't bombard yourself with studies. Shit पढ़ना है यार पढ़ना है. Don't take it in that way.
So
थोड़ा chill
how
मार
many
के
hours
पढ़ो.
do you study, Viva?
सर इन माय फर्स्ट ईयर जैसे अभी मैंने बताया मैं ऐसे डिस्ट्रीब्यूट करके ही पढ़ती थी एंड आई एम नॉट अ नाइट पर्सन मोस्टली आई वेक अप इन द मॉर्निंग एंड यस 2 hours
Perfect.
तभी फिर आफ्टर कमिंग फ्रॉम कॉलेज दैट्स माय शेड्यूल.
Okay, thank you for the answer. Somebody is saying Radhe Radhe sir, I am from Mathura. Radhe Radhe Physio Notes Hub. Good evening, Mukesh Kumar. Good evening. So, what's your thoughts about BWalk Vocational in Physiotherapy, Bachelor's in Vocational in Physiotherapy course? That's a good course. Again, vocational training you must be learning. Like जैसे फिजियोथेरापी में आप पढ़ते हो ये सीबीआर में फाइनल ईयर में, कम्युनिटी बेस्ड रिहैबिलिटेशन में वोकेशनल ट्रेनिंग क्या होता है, इंडस्ट्रियल बेस्ड ट्रेनिंग क्या होता है, तो वो एक काइंड ऑफ इमर्जिंग फील्ड है जो आप एक्सप्लोर डेफिनेटली दैट्स गुड, not bad in recent terms. Okay, I'm stuck over there or I'm properly
नो सर यू आर नॉट विजिबल.
okay, because actually I got a call and after that my photograph I can see I'm stuck over here. Okay, maybe it will resolve by itself or we'll see. It's okay. So next is please put a light on dry needling, cupping, taping, ISTM. No, I don't want to put any lights. Let it be in dark. Okay. Sir, is it recognized by any state council? What? Uh, Vocational training, no. As of now, we don't have enough state councils also in India, so don't expect that. But if you really have interest, you can do that. How can I prepare for MP3 exams? Raj, as I mentioned earlier, you can start with the basics, and later on, you can just work on your basics to prepare for the entrance exam. And for that, maybe Viva, we will conduct another session. I think, right?
यस सर.
Because I guess NPT entrance exam is a good topic. We can discuss over it sometime, right?
इट विल बी बेनिफिशियल फॉर मी टू सर बिकॉज आफ्टर 1 year eventually प्रिपेयर करना ही है.
Yeah, so we'll talk about that also. Yes. So I guess we'll just end our session for now here, Reba.
या यस सर.
Yes. So I hope, guys, every one of you will not repeat this mistakes what we have just discussed. कि एज अ स्टूडेंट आपको क्या नहीं करना चाहिए, वो आपको ये लाइव में सीखने मिला होगा लाइव सेशन में. एंड अपार्ट फ्रॉम दिस ऑल्सो इफ यू हैव एनी डाउट्स यू कैन एनी टाइम गेट बैक टू अस. यू कैन message us on our Instagram profiles or you can comment on this video as well and we will try to help you out over there. So namaskar, Radhe Radhe, and thank you so much, Viva, for being there.
ओके थैंक यू सर.
All right, and we'll see you like all the doubts and all will continue in the next session. So good night.
या
Thank you all.
गुड नाइट. या